Okay, so the treatment I'll be demonstrating today is the Paraffin Bath, named after our classmate Josh. Um, so the goal of the treatment for this one will be to increase tissue temperature rise for tissue healing. Specifically for this case, we'll be working on extensibility of the connective tissue to increase range of motion. And you'll want to use paraffin if you want to achieve the physiologic effects of tissue temperature rise. The contraindications for this one are similar for all the other thermotherapies, but we're going to focus mainly on checking the area for open wounds, and if they have the wounds, we obviously won't use the paraffin bath for that. And before we treat, we'll assess the skin for sensation, obviously, and we'll ask the patient if it gets too hot during treatment to let us know, because we don't want it to burn. And then for the parameters of this treatment application, we're going to have the temperature of the wax be between 118 and 126 degrees Fahrenheit, but we need to have it above 120 for the paraffin wax to actually melt. Application of the modality, we'll just be using one of the distal extremities, and we'll dip it into the paraffin wax container that we have here. And other considerations is patient positioning, and for our patient here, we'll be using his hand. So seated is fine as long as they're comfortable. You just dip it 6 to 10 times. Each time going, the first time you go most proximal, so you'll go up onto the wrist for this patient, and then each time down you'll go a little more distal. So you have layers building up, and then afterwards you'll wrap it to secure the heat. As you can see, we got a container full of paraffin wax. Okay, and so to demonstrate, we'll take Andy's hand here, we'll dip it into the paraffin wax, and then remove, and then dip it again. Do that about 6 times, each time going more and more distal. And then afterwards, you can wrap it, and then you can just hold it there as it heats up for about 15 to 20 minutes, like typical thermotherapies. And the other interventions we can use would be hot pack, fluidotherapy, Thermex, other treatments that can increase that tissue temperature rise.